Chiropractic care has become a staple of medical care in the United States and surrounding countries. Welcome to Doctors on Call. I'm Jenna Miller. It is estimated that more than 27 million Americans are chiropractic patients. Many chiropractors also specialize in sports therapy. In fact, doctors of chiropractic are used by all 32 National Football League teams to deal with ongoing back and neck problems. DCs practice a hands-on, drug-free approach to healthcare that includes patient examination, diagnosis, and treatment. Through extensive research, statistics widely report chiropractic to be an effective treatment. Chiropractic care is our topic tonight on Doctors on Call with our guest, Dr. Shelby Darnell of Plainville.
Presentation of Doctors on Call on Smoky Hills PBS is made possible in part by an underwriting grant from Gove County Medical Center in Quinter. Healing through caring. Blue Cross and Blue Shield of Kansas, serving approximately 950,000 Kansans in various programs. A value Kansans trust. Blue Cross and Blue Shield of Kansas, an independent licensee of the Blue Cross and Blue Shield Association.
Russell Regional Hospital, experts, neighbors, friends.
Dr. Shelby Darnell grew up in Plainville, Kansas, and went on to play volleyball and participate in indoor track at Pratt Community College. She earned her bachelor's degree in human biology and her doctorate in chiropractic from Cleveland University in Kansas City, graduating cum laude. Dr. Darnell earned her 100 hours of functional medicine and chiropractic family practice from the ACA Council on Diagnosis and Internal Disorders. She has completed more than 300 hours of postgraduate study of diagnosis and treatments of internal disorders. Dr. Darnell is currently obtaining her diplomate of the American Board of Chiropractic Internists. Prior to Restoration Health and Chiropractic in Plainville, she served at KC Core at Overland Park Regional Medical Center. Give us a call at 1-800-337-4788 toll-free with your medical questions about chiropractic care. Doctors on Call brings you information which may be useful to you when you see your own physician or chiropractor. Thank you so much for joining us tonight, Dr. Shelby. We are going to start with some questions of our own before we wait for those calls to come in. Let's first talk about why a person should choose chiropractic care.
Chiropractic care is good for anyone with any aches and pains, and especially with their activities of daily living. So whether that be sitting at your desk at work and something's bothering you, or you play sports and something's bothering you, then a good option is chiropractic care.
Absolutely. How does a person go about, we talk about that a lot on this show, how does a person go about selecting the right chiropractor for them?
I think it's important personally to do your research beforehand. Go on the internet, read people's websites, look for somebody who is going to look at you specifically. Do a thorough exam, find out exactly where your pain's coming from, and treat you as a person.
Okay, and if a person does that and they just don't feel right about it, you believe that it's okay to move on and try to find somebody else?
Yes, there are chiropractors who practice a wide variety of treatment styles, so there is another option if you don't like the specific chiropractor that you've chosen.
Okay, so let's talk about some of those differences from chiropractor to chiropractor.
There are certain chiropractors who just do an adjustment. There are chiropractors who use more modalities such as E-stim, myofascial release, things like that. And then there are chiropractors who do rehab exercises, similar to a physical therapist to help with pain management.
Okay, and so for those of our viewers out there who don't understand what maybe E-stim is, let's talk about that first.
Okay, E-stim is a modality where pads are placed on your skin, and what that does is put an electrode into the area and fires those muscles. It's really good for pain relief.
Excellent, and then the myofascial, what's that?
Myofascial release, so their muscles in your body are surrounded by a fascia. That just gives structures to those muscles. So what we do with myofascial release is break up any adhesions that have occurred in that muscle that are causing pain or anything like that.
Okay, now something that sets you aside from other chiropractors is that you make house calls. Let's talk a little bit about that.
House calls are great for those people who have that really busy lifestyle or can't step away from work to go to an appointment. I can come either to your workplace, if that's okay with you, or come to your house and treat you in the comfort of your own home.
Okay, so let's explain how that works.
So I bring my portable table to you. Your care would be similar to a care that you would go to an office. However, you're eliminating any wait times, any drive times, and like I said, the comfort of your own home. We still do an initial exam and we still do treatment just as if you would come to my office, just more convenient for you.
Okay, excellent. Now, what kind of response have you gotten back from patients who you've done in-home treatments or at work?
Patients really enjoy it. The fact that they don't have to get out, bring their children to an office. It's just easier for them, especially with the busy lifestyles. There's tons of sports activities for children nowadays, so it's just easier on them and it's more comfortable.
Okay, now let's talk about whether a person comes to your office or you go to them. Let's talk about that initial treatment and what they can expect.
So my initial treatment lasts 30 minutes. We start by doing a lot of questioning. Where is the pain coming from? How did the pain start? A ton of questions over the pain specifically. We go through your history, make sure we go through surgeries, any other health conditions that you have, and then we do a thorough exam. Make sure vitals are all good. We do an examination to see where the pain is coming from, what's causing your pain, and then we base the treatment off that. We also make sure that you are a candidate for chiropractic care. And then I do my treatment, which typically involves 25-30 minutes of muscle work, and then we do the adjustment.
Okay, excellent. We might talk a little bit more about that, but right now we're going to go to the phone lines. We've got a caller from Spearville who's waiting to ask a question. Go ahead with your question for our chiropractor tonight.
Yes, I was diagnosed with neuropathy, and I was wondering how you would treat that.
So it depends on where the neuropathy is. Some people have neuropathy of their hands, some people have neuropathy of their feet. Some people will respond well to chiropractic treatment. Some people with neuropathy, depending on how far it progressed, may not see any progression in their condition. So it depends on where you specifically are at. My treatment may not differ much from what I normally do, but like I said, it's different for every patient and exactly where you're having pain.
Okay, we're going to go back to the phone lines, and this is Stephanie on the line from Hayes. Hi, Stephanie. Go ahead with your question for Dr. Darnell.
Hi, I'm expecting my first child and was wondering if it would be safe for my infant to receive chiropractic care, when I should consider having my children be treated.
Yes, chiropractic care is generally safe for all ages. Make sure that a thorough exam is done and somebody is trained in seeing children. There is a specific technique called Webster technique for pregnant mothers, which is great, but it's just important for people who see children. I would suggest you find somebody who is more familiar with treating children, but it is safe.
Absolutely. Now, how soon can a child see a chiropractor?
People have seen, a lot of people have chiropractors come to the hospital and just right after birth. Some people wait maybe until they're seeing signs or symptoms, maybe colic, something like that, to bring their chiropractor in, but it is safe, even right after birth.
Excellent, very interesting. Now, you had talked about a little bit before the callers called in about being a candidate, to see if they would be a candidate when you do that initial exam. Who might not be a candidate for chiropractic care?
Somebody maybe with chronic pain that's coming from an underlying health condition, especially if their activities include maybe smoking heavy and they've had previous history of stroke, maybe some cancer patients, depending on where their cancer is located, and just stuff like that. So make sure, I always take vitals on my initial exam just to make sure that maybe that day they're not having, you always have to rule out the big things before you treat anybody.
Excellent. Okay, what are some misconceptions that you find face chiropractors?
The biggest one I believe is once you start going, you have to keep going forever for chiropractic. And I truly don't believe that's true, because as long as a chiropractor has determined where your pain is coming from and you're on the right path, your pain should go away and you shouldn't have to keep coming. Now, you may have to come back once a month, maybe once every 3 months if you can feel the pain coming back on, but you shouldn't have to go forever if your direction of care is in the right way.
Excellent. Now, how often can a person go too often to the chiropractor?
It depends, especially if they're hypermobile. So the reason that we adjust is to put motion into an area of decreased motion, and that is what is going to make you feel better. Now, if somebody is moving too much in a joint, you don't want to put more motion into that joint because you can make hypermobile. So there is a fine line, and your chiropractor should be able to determine that.
Okay, you mentioned that your treatments include 25 to 30 minutes of muscle work. How important is that to do the muscle work before you actually do the treatment?
Adjustment.
Yeah, the adjustment, yes.
Yeah. I believe the muscle work is just as important as the adjustment because those muscles attach from one bony structure to the next. If there's tightness in that muscle, it's going to keep putting tension on that bony structure. So we can put motion back into that structure, but if those muscles are not released, it's just temporary. So we get more effective pain relief and a longer lasting adjustment if we address the tissues around there, get that more relaxed, then adjust. We get more effective treatment.
Excellent. Do you find that patients don't have to come back as often when you do it that way?
Yes, and we get quicker results.
Excellent. Very interesting. Now, we talked about what they would experience in their initial appointment. What about appointments after that?
Typically, appointments after that last 30 minutes. You come in, make sure nothing new has happened to you, no new health conditions, no falls, injuries, or accidents. See how you're feeling better, make sure we are on the right path, make sure you are progressing, and then we start treatment again, do the muscle work, and then the adjustment.
Now, does a patient have to be referred from a medical doctor, or can they go directly to you?
Yep, you can come directly to me, especially for any mild aches and pains, and you know it can be handled by a chiropractor. Some people do go to their medical doctor, don't really know what's going on, so they go there first and then they get referred, but you don't have to have a referral.
Excellent. And we've talked before in previous shows about the difference between physical therapists and chiropractors. Let's touch on that a little bit.
Okay, so it honestly depends. There's a wide variety of chiropractors out there. For a chiropractor that just adjusts, there is quite a bit of difference because a physical therapist does more active treatment where the patient is doing exercises and stretches on their own under the guidance of the physical therapist. Now, there are chiropractors out there who specialize more in the rehab and the exercise, so you go into their office and they treat you kind of as you're doing that. So with those people, there's not much of a difference. They're more similar because now physical therapists, you can go to a physical therapist without a referral, and they are starting to be able to adjust as well.
Okay, so you feel patients can benefit from both?
Yes.
Absolutely. And what are the most common conditions that you treat in your practice?
I see a lot of headaches, a lot of neck tension and tightness, low back pain, sciatica pain, and plantar fasciitis.
Okay, and let's talk about treating those conditions.
Okay, so headaches. Mm-hmm. A lot of headaches come from muscle tension, either in the back of the skull or even tension in the muscles surrounding the head, maybe associated with jaw clenching. So I believe that it's important to address those tightnesses and stuff with headaches. Same with the neck tension. A lot of people, desk jobs, sitting forward causes tension, so it's important to address those muscle tightness there. Plantar fasciitis is one not a lot of people know that chiropractors treat, but a lot of plantar fasciitis comes from calf tightness. So if you address the calf tightness, you can see results, pretty good results in plantar fasciitis. Low back pain and sciatica pain, that's a common treatment that chiropractors do address.
Absolutely. We had talked about in the intro that chiropractic treatment is safe. Let's hear from the doctor why it is safe.
Chiropractic care is very conservative. High velocity, low amplitude adjustments, as long as you're a candidate for chiropractic care and you're not hypermobile, the adjustment it's very conservative.
Excellent. Now, is there pain involved in an adjustment?
I would say it depends on how severe your complaint is. If you're in a lot of pain, it just happened, putting that force in there might be painful, but over time as you're progressing, the adjustment should not be painful.
Excellent. And what are some different methods for those that are suffering from chronic pain?
So chronic pain is different in the fact that it's been going on for a longer period of time. Therefore, you're probably going to have longer treatment versus somebody who just hurt their back and came in for some treatment. The chronic pain, they do well with the myofascial release because what we're doing with that is we're breaking down those tissues that have contracted together and adhesed together. So if we can break down, remold those tissues, they usually see good results.
Excellent. We want to remind our viewers that we are talking about chiropractic care tonight. You can give us a call toll free at 800-337-4788. We have Dr. Shelby Darnell from Plainville here tonight talking about chiropractic care. So how important would you say exercise and physical activity help in assisting chiropractic treatments?
So especially for the muscle tightness, if you have an injury to a muscle where it has contracted and is shortened, getting blood flow to that muscle will help relieve that. So if you do injure yourself, one of the things that will get you quicker results is to keep moving, keep blood flow to that area. It's similar to now what the evidence is showing for sprains of the ankle. If you want to return to play quicker, maybe we don't put ice as long as there isn't a full ligament tear. So if we just have a little bit of tear, maybe a little bit of sprain, if we could weight bear and keep moving, keep blood flow, allow that inflammation to come, we actually heal quicker than if we would do the typical rest, ice, compress, and elevate.
Excellent. Now let's talk about the difference between using heat and using ice. When should you use which?
Okay, so if you apply ice to an area, you're taking away the blood flow to the muscle. That's great if you're trying to reduce inflammation, whereas heat will bring blood flow to an area. So those tight, constricted muscles, maybe tension in the neck, putting heat on there and then stretching that will actually increase the healing quicker.
Excellent. And is there any truth to going back and forth between the two?
Yes, pain relief. Actually, if you do start with ice, 20 minutes ice, 20 minutes heat, 20 minutes ice. Start with ice, end with ice. You can repeat as many times as you want, but that's really good for pain relief.
Excellent. Right. Now, how long after a treatment can you go out, play sports, or be real mobile? Should you, take it easy after a treatment?
That really depends on the severity of the injury. So if you've been if you have an injury not really bothering you for a long time, the activity is good for the most part. Now, if you have a real severe injury just happened today, it probably is better if you do rest and take it easy.
Okay, now what would be the difference between a patient, if they have an injury, that they could either come to you versus going to the emergency room? When would they know which to do?
It really depends on the severity and probably the location. One thing that we always look for, we always rule out before we start care, is if there's a disc injury or a nerve interference. So that is really important in the exam. If we have a disc injury causing sharp shooting pain down into the arm, we need imaging. That's probably something we go to the emergency room for. Something you can manage the pain well, you can deal with it for maybe a day, you can come in and see the chiropractor for versus going to the emergency room.
Now, are chiropractors able to order those imaging?
It depends what type of relationship they have with the local hospital. Maybe some chiropractors have an x-ray machine in office. Disc injuries are usually MRI, so it just kind of depends on what's going on with the patient and then what type of equipment the chiropractor has in office.
Excellent. Let's talk about what spinal manipulation is.
Spinal manipulation is the adjustment, just manipulating that joint, putting motion into an area of decreased motion.
And if you didn't actually do the muscle work before, how long could that, stay in place if you just did the adjustment?
It honestly depends on what the patient's doing. If you're not very active, do the same thing every day, maybe it will last longer. A little bit more active, doing different activities, heavy lifting, it probably isn't going to hold as long as if you would get the muscle work done.
Excellent. And describe what is happening when you actually hear that popping sound.
So the popping is just a nitrogen release within that joint capsule, just as if you pop your finger or anything like else you move, you hear a pop. It's just a nitrogen release of that joint capsule.
Okay, so you know, we hear differing opinions about, you know, cracking your knuckles, that it can be damaging, it's not. What is your take on that?
So the more you do it, the more you feel a need to. Sometimes it's just habit that people get into. My thing with the neck, if you stretch and you hear a pop and it pops that way, that's okay. But the people that, you know, really shove their neck, you can add a lot of mobility in areas that don't need mobility. Plus, it makes it harder for the chiropractor to adjust you when you are hypermobile like that.
So can you describe the treatment method of the trigger point therapy?
Okay, so a trigger point is just an area of a muscle that adheres together, and a lot of people feel them and call them knots. So that's just kind of a trigger point, and those can be painful. So what we do with the trigger point therapy is we use sustained pressure on that knot, and that is the most effective way to get rid of that knot. Breaks it down and allows that muscle to re-lengthen as it should.
And going back to that popping sound, I wanted to ask, if a patient actually doesn't hear that popping sound, does that necessarily mean that that's not moving?
No. Yeah, the most important part of the adjustment is the motion back in the vertebra, because that is what's going to actually cause the pain, and that's what will make it feel better. So as long as we restore that motion in that joint, they should feel better, and it's not that pop that we're looking for.
Okay, can you describe what, I've got a few things here that I'd like to go through, the pin and stretch.
Okay, so pin and stretch, it's similar to if you've heard of active release therapy. What we do is we shorten a muscle, we put pressure on that muscle, and then we re-lengthen it. So we're trying to lengthen contracted muscles.
Okay, what about kinesiotaping?
Okay, so the kinesiotaping, it's kind of a stretchy tape, and what we do is we apply that to an area. What that does is the sensory fibers in the skin will send signals to the brain to just promote healing, some relaxation. Some patients find that it helps them a ton. Some patients don't find as much relief with it, so it just depends patient to patient.
And you can put that tape anywhere, arms,
Yeah,
back?
Yep. A lot of people use it during sports, but I use it on patients' low back tightness, things like that. Spray some biofreeze on it, and they usually get a lot of relief with that.
And how long could it last, one piece of tape, I guess?
It depends how often you shower, how much you're sweating, how much you're moving around, maybe stretching that tape. It should last 3 to 4 showers usually, as long as it's not bothering the patient.
Excellent. And what about hypervolt?
So the hypervolt is an electric tool. It's more of a percussive tool. Usually it's more for pain relief than anything. It's kind of like a massager, so the patients always say it feels good. I like to end my treatments with that because the patients do enjoy it.
Excellent. And what about patients that might be suffering from osteoporosis or arthritis? Are you able to treat them?
Yep. It's kind of the same thing. Decreased movement in the joint. We add some motion in there, and they do get some relief with that.
Excellent. And what about fibromyalgia, and how is that treated?
So fibromyalgia is kind of the pain all over associated with muscle pain. So typically with a fibromyalgia patient, they come in, what's bothering you today? We address those areas, and then that's how we treat them, because it can differ from appointment to appointment what's bothering them. So as long as we treat what's bothering them that day, they usually get relief.
Excellent. What about flexion distraction?
Okay, so flexion distraction is actually kind of what the table does. So it kind of bends at the waist, and what that does, it comes up and down so that your legs are going up and down. And that's more for people with disc problems. And what we're trying to do is pump that disc and try and reabsorb, get some motion in that disc, provide some relief for the patient.
Excellent. And Thompson technique?
Thompson is more of a leg analysis to see where you adjust. So you hear a lot of people, I have a longer left leg than my right leg. So what we're doing is we're looking at the length of the legs to see which side of the pelvis that you need to adjust.
Excellent. And what about diversified techniques?
Diversified is what most people think of as an adjustment. It's the high velocity, low amplitude manual adjustment with the hands.
Okay. Let's talk about how important a good pair of shoes is for a person.
It starts at the ground and it works its way up. So if you don't have support in the shoes, causing you, maybe you walk inwards, maybe you walk outwards, that will put different pressures on your knees, can tighten the calves. Once it starts moving up, we just keep going. So it can cause knee pain, and then it can cause hip pain, and then it can cause neck and low back pain. So it's really important to get a supportive pair of shoes.
And how do you know if you're getting, is cost have anything behind that? What's a really good quality pair of shoes?
Comfort and arch support. Make sure you're comfortable. You can wear them for a while without having any pain, things like that.
Okay, and I know we're in the colder months right now, even though in Kansas, Pete, you can wear flip-flops whenever, but
Yeah.
how do you feel about wearing flip-flops, all the time?
Yeah, they do make flip-flops that have a better arch support and better support. The really flat ones with no padding, no arch support whatsoever, not as good. If you wear them every day, you might start noticing some aches and pains, pressures in other places.
Excellent. Well, our thanks goes out to Dr. Shelby Darnell from Plainville Restoration Chiropractic Care in Plainville. Thanks so much for being our guest tonight. On our next Doctors on Call, we'll be discussing dental health. You can email questions to us for our next program. That's doctors@shptv.org. Thank you for joining us for Doctors on Call. I'm Jenna Miller.
Presentation of Doctors on Call on Smoky Hills PBS is made possible in part by an underwriting grant from Gove County Medical Center in Quinter, healing through caring. Blue Cross and Blue Shield of Kansas, serving approximately 950,000 Kansans in various programs. A value Kansans trust. Blue Cross and Blue Shield of Kansas, an independent licensee of the Blue Cross and Blue Shield Association.
Russell Regional Hospital, experts, neighbors, friends.